Discussions in this show should not be construed as specific recommendations or investment advice. Always consult with your investment professional before making important investment decisions. Securities offered through Cambridge Investment Research, Inc., a registered broker-dealer, member FINRA SIPC. Fixed insurance is offered through various independent insurance companies. Cambridge does not offer tax or legal advice.
Welcome to the SA Update. I'm your host, Mike Schuster. Each episode, we dive into meaningful conversations and timely topics designed to empower our communities and clients. From financial insights to real-life confidence, we're here to help you stay informed, inspired, and ready for what's next. In today's guest, we have a friend of the firm, Mary Santon. Mary, welcome to the podcast today.
Thanks, Mike. I'm excited to be here.
Yep. So Mary works in the industry of Medicare supplements, and Mary's worked with us since even before we founded our firm. Fritz and I found Mary, and you've been a blessing to our clients. And thank you for agreeing to be on our podcast today, because when you look at covering Medicare and you look at or covering this topic of Medicare, it's such a big subject, and it's great to have a resource like you out there and people that do what you do out there. So we're going to today you're going to help us uncover some truths and some myths about Medicare. So that's our goal today. So just to kind of get backwards with or talk why this is important is it is essential for seniors and people with disability to have Medicare, and it's often misunderstood and misused. So let's start with one of the biggest myths out there. Mary, does Medicare cover everything?
Absolutely not. It is great healthcare coverage. However, Medicare does have some copays. It has some deductibles. There are some limitations under Medicare. Original Medicare itself does not cover dental, vision, and hearing aids or pharmacy. Pharmacy is another portion of Medicare that you need to enroll in when you sign up, and that is the Part D, the prescription drug coverage.
So another common myth is you're automatically enrolled in the best plan. So talk about that, Mary.
Absolutely. When you're automatically enrolled, the only way you're automatically enrolled into Medicare A and B is if you're already receiving your Social Security check or receiving widow benefits or SSI and get converted over into the Medicare arena. You do need to raise your hand, as I tell people, if you are not receiving your Social Security benefit, you must actively pursue that enrollment. Now, let me clear up one myth that goes on, and that is people thinking that I'm not taking my Social Security check, so I can't take my Medicare. That is not true. They're two separate divisions, if you will, in the Department of Health and Human Services. You can enroll in your Medicare Part A and B and not take your Social Security check and wait to defer that until your full retirement age. So that's one thing I always try to clarify with people, is to make sure that they are clear about that. Now, another situation that I encounter frequently is people are getting their group health insurance, and I'm talking about a large group, over 50 employees. If they are receiving group health benefits, they do not need to enroll in their Medicare Part A or their Part B. They can defer that. However, I usually recommend that even if you're accepting your group health insurance coverage after the age of 65, to go ahead and enroll in your Part A. Part A is already prepaid, all those years of taking out your FICA and your Medicare taxes. You're prepaying your Part A, so you might as well get that benefit. Part A will cover exclusively inpatient hospital coverage. So if, for example, you are working and you have your group health insurance and you get hospitalized for whatever case, maybe in a case of pneumonia or ruptured appendix, whatever, if you had already enrolled in your Medicare Part A, you're allowed to file your group insurance as primary, Medicare Part A would be your secondary coverage.
Okay.
So you would have a lot less out-of-pocket exposure than if you had just group insurance alone.
So basically, there's no downside to enrolling in it. So at this point,
Absolutely not.
okay, perfect. So, and this is a complex subject, as most people can see here, and we tend to break this podcast down here into a couple different spots. Before we go any further on this, my next question is going to be a very, very complex question. It's something near and dear to both of us, and you've been a godsend in helping us with this. And that is the confusion between original Medicare and Medicare Advantage. And one of the things as a certified financial planning professional that I run across is people run to the lowest premium and say they love this Medicare Advantage plan. However, I want to state that we have so many good physicians and so many good doctors in these communities that we are in Nebraska that sometimes that excludes them. And people love their physicians. And I think one of the strengths of Nebraska is we have great healthcare in this state. And talk about that, the Medicare, original Medicare and Medicare Advantage, and then of course the ability to use your physician.
Okay, great question. Yes, there is a lot of confusion, and I concur with you that people run to the lowest premium, and that is wonderful if you're healthy. But if you are not healthy, you literally will be spending more for your health care than if you stayed with the original Medicare from the get-go. Let me break it down a little bit. Medicare, original Medicare is a federally funded program, and it was rolled out in 1965. The MA plans came to market in 2003. Those plans now allowed private insurance companies to manage your healthcare needs. With traditional Medicare, those plans are heavily regulated by by the feds, and with that regulation, they're required to bill a certain level. With MA plans, or many, they're called Medicare Advantage. I call them Medicare alternative plans because those plans are utilizing physician networks. They are controlling costs by um, eliminating or denying some of the coverage that you would have under original Medicare. I have 20 years of pharmaceutical sales in my background before I became a Medicare uh, dedicated individual. Um, with that 20 years of background, I've seen doctors in their offices be extremely frustrated when they have to get prior authorization for everything. And I believe that it puts an excess burden on the providers, and many of them are reimbursed so poorly that they do not end up wanting to take that coverage. And so you're right, Mike, when you said there's a lot of providers that say, I'm not going to mess around with this. I got called by an oncologist the other day, and he explained to me how frustrating it is for him to treat a cancer patient that has an MA plan.
Wow.
Those patients usually have to get a prior authorization before he can start treatment. Now, in this world, I look at, you get a cancer diagnosis, Mike, today, you want to treat it now.
Absolutely.
You do
Yeah.
not want to wait to have the insurance companies authorize it. So I am not a big proponent of the MA plans or Medicare alternative plans. And the other myth that I really want to focus on
Okay.
is they are told that you can come back. If you choose an MA plan, you can come back to original Medicare at any time. And that is absolutely false. There are only 3 ways in which you can come back to original Medicare if you've chosen an option of going to the Medicare alternative option. Number 1, if the company leaves the area. If they leave the area, they're going to mail out a letter that has your name and letting you know that that company is leaving. That is truly your gold ticket. Do not lose it. Do not destroy it. find a reputable agent because it allows you to come back to traditional Medicare without having to go through medical underwriting.
Can I ask a question on that?
Sure.
Is that something that you see happen often? Because it seems to me that the Medicare Advantage plans, again, sound sexy, but then end up causing a lot of heartache for people out there.
And I will tell you, last year there was one company in this region that did leave and gave people the letter. They gave them the opt-out. They were readily available to go back to original Medicare.
That's good.
Okay, that was situation number one. Situation number two, when you can leave an MA and come back, that's if you've been on the MA for less than 12 months and they give you a trial right. That trial right will allow you to return back to original Medicare. If you left a supplemental company to go to the MA, that supplemental company has to take you back at the plan level that you were entitled to. So I tell people that's a biggie. The third way to come back to traditional Medicare is October 15th through December 7th. During that AEP, that annual enrollment period, you can leave your MA group and come back over to traditional Medicare. However, you do have to go through medical underwriting.
Okay, that was going to be my question, is regardless of pre-existing conditions, and you're saying no, if you have pre-existing conditions, that's the thing I think that's really, really important, because from a financial planning standpoint, if you have pre-existing conditions and you don't have the right coverage, you're going to have less than medical care, or you won't get the right medical care, or you'll be paying out of pocket. Very, very important piece of things. And I'm glad we double clicked into that.
Discussions in this show should not be construed as specific recommendations or investment advice. Always consult with your investment professional before making important investment decisions. Securities offered through Cambridge Investment Research Inc., a registered broker-dealer, member FINRA SIPC. Fixed insurance is offered through various independent insurance companies. Cambridge does not offer tax or legal advice.